everyone. Welcome, and thank you, CR, for having me. It is a pleasure to be here working with some really incredible clinicians, and it's been a great presentation so far from Mike, and Dave. Dave's the odd one out. He doesn't have an M name, so we've got the triple M plus Dave, and Mark if you add him in too. So we've got the four M's. I would consider myself an expert in this field. I graduated dental school 5 years ago, so I am still fresh in my dental career. I'm still smiling, is what you could say. So I just have a couple slides that I would like to share with a lot of experience of what I wish I knew first out of dental school. So you've transformed into a dentist overnight. You graduated dental school. You went through the 4 years of, some say torture, some say excitement, where you've learned all the ins and outs of composite restoration. Some of you are still learning about amalgams. We've learned about crowns. We've learned how to take out some simple extractions and different things like that. There is so much more for us to learn once we've left dental school. There's only so much they can teach us in the first 4 years. And something that Mike and I had talked about is dental school gives us just enough information to be legal dentists. So it doesn't give us enough information to be the best clinician that we can be. That's our responsibility once we leave dental school. There's so much more out there once we leave that it's up to us to decide if that's something that is important to us or if we're just going to be our average dentists. And I know everyone here watching these presentations is yearning to be the best clinician that they could be. Now, something that's also important to take into consideration when you graduate dental school is how to navigate a career in healthcare. It's a different type of career to have, and there's been a lot of focus in the healthcare fields in general, not just dentistry, not just medicine, about the things that we can do to make our lives a little bit better and happier, because happier clinicians are able to take care of their patients so much better. So the biggest thing that I've noticed right out of dental school is sharing experiences. We share experiences with the people around us, and that's how we gain knowledge. This doesn't include just the bad experiences. This can also include the good experiences. It's important to be able to discuss things that are happening to us in practice with our colleagues, with our friends, our family, with other dental professionals, with our staff. It's just important being able to learn how to communicate and be able to share different things, because you never know what someone else's experience that you're going to be able to learn. Someone may have shared a negative experience on an extraction that it took them way longer than they had planned in their schedule, and they ran really behind, and they are venting to you sharing this experience that they see as negative, but maybe you learned something out of the experience that they spoke to you about. And vice versa, you could give advice and be able to give them knowledge as well. It's very important to be able to form these communicative groups where you can share your different experiences to grow, because isolation equals becoming stagnant in my mind. That being said, it's very important to find a community where you can have these shared experiences. Something that I always thought was kind of funny is there was one day I was talking about how hard a root canal was, and I was really struggling, and I was so worried that I was going to break a file off in the tooth, and I was complaining about this to my father, who ended up needing a root canal a couple weeks later and was very hesitant to get it from me because I had vented to him about how hard this specific day was. So I know a lot of my colleagues have also experienced things like this, and it can form a little bit of isolation because you cannot necessarily vent about your hard day to your spouse, your parents, your children. And if you can't talk about the nitty-gritties of your hard day with your spouse or your family, how are you going to be able to process negative things that can happen to you at work? So it's very important to find a community of professionals in the same field as you that you can talk about positive and negative experiences without it changing how potentially, because a lot of us see our family members as patients, potentially how patients see us as professionals. It's very important to be able to find peers with these professionals in our community. And these can be other dentists. These can be different specialists that we refer to. I know a lot of people find really good professional connections with the specialists that they work with. Some people have no communication with the specialists that they refer to. And so I would very much recommend that you form good communication and good relationships with the specialists that you refer to if you refer to specialists. There's a big dynamic shift after you graduate. You're not a student anymore. A lot of dentists, when they first leave dental school, have a really hard time being able to change that mindset that they are not a student anymore and they're actually the clinician. There is a big movement on TikTok, if any of you are on TikTok, about how people are saying, oh, they are asking the doctor, they say, come get the doctor. And I'm the person that asked my boyfriend to kill a spider this morning, and I forgot to do my laundry last night, something like that. And that's a big thing that we're seeing right now is it's a crazy mind shift to be able to switch from, oh, okay, I am not just a student anymore. I'm actually the clinician. I'm in charge of patients. I'm the one taking charge of their care. And so it's something very interesting that a lot of people aren't able to process, and they need to be able to find a community where they can process and joke about different things like that as well. Another thing that people have a hard time with is being able to recognize who they can form their community with in their office. Dentists, if sometimes they are the boss. If you're in a solo practice, you are in charge, and all of your assistants and office managers are your employees. And so it's very hard to be able to find that line of how you can create friendships while still being the boss, or not create any friendships and only be the boss with your employees. And so that's very hard to be able to manage. And there are so many other dentists and specialists out there in the community that can give very good advice. And that's something that I struggled with when I first went into practice. I was an employee. I was not an owner. And so I couldn't figure out if I should be able to make friends with all of the assistants and go to dinner with them and hang out with them because I wasn't in charge of their salary. But then maybe they were more relaxed around patient care to me, but they weren't as relaxed with the boss. So that's something that you just have to think about before you get a job, how you want to be perceived by patients, how you want to be perceived by staff, and how you would like those relationships to form in your workplace. I found a really good quote because during times of COVID, there was a lot of isolation. And so there was a quote that I'd like to read for you all. Hockley points to evidence linking perceived social isolation with adverse health consequences, including depression, poor sleep quality, impaired executive function, accelerated cognitive decline, poor cardiovascular function, and impaired immunity at every stage of life. In addition, a 2019 study led by Cassandra Alcaraz, PhD, MPH, a public health researcher with the American Cancer Society, analyzed data from more than 580,000 adults and found that social isolation increases the risk of premature death for every cause, for every race. So this is something that's very important. If we're not able to find our community out of dental school, then that can give us a form of social isolation. And like I talked about before, sometimes you can't necessarily talk about your day in great depths with your family members at home without them thinking about you being a dentist as well. And that can lead to a lot of social isolation. And social isolation can cause a lot of problems for our own health. Not only just mental health, but this is also showing that it can be our bodily health as well. So it's very important to be able to find a community that we can communicate with, bounce ideas off of, be able to share bad days, be able to share good days, so that we don't have social isolation, so that we don't worry about having healthcare problems come to us. All of you have always heard the joke. It's not necessarily a joke, but everyone talks about it in the medical field that one of the number one careers that they see suicide rates the highest is dentistry. And so that's something that is very important to me to be able to combat. And one of the ways that I would like to combat that is being able to rid the social isolation, because social isolation, as we can see, it can cause a higher incident of depression in the providers. We also know that providers that have healthcare problems are not able to give the best quality care for their patients as well. So being able to take care of ourselves first, we can take care of our patients even better. This is a picture of my dog. A lot of people find their community in their pets when they're first starting out. So I would also like to just share that this dog, Bruce, he's gotten me through a lot of fun times with dentistry as well, because he's never going to judge my root canals or my extractions after a long day. So I can always count on Bruce to be there for me. Another thing, kind of shifting gears a little bit, another thing that's very important when you first leave dental school is continuing your education. We talked about you have just enough education to be a legal dentist, but not to be the best clinician ever. So our goal to strive towards being the best clinician ever is being able to find reliable continuing education. I myself probably wasted a lot of money going to not reliable continuing education courses that seemed like they looked really good. So the best advice I could give for finding reliable continuing education is act like you're going on a big European vacation, and you're going to do a lot of research because you're going to spend a lot of money and you want to go to all the best places. So that kind of effort that you put, I want you to put into your continuing education as well, because your continuing education is an investment. A lot of these courses are pretty spendy, so you're going to be spending some money. So you want to make sure that it's worth it. And it's a good course and you actually learn something, because the worst thing that can happen is you go to a course, you sit on your phone the whole time and you don't take anything back to share with your patients. There are different types of continuing education courses, which I did not know until I graduated. You do have hands-on continuing education courses where you actually get to work on models, and some courses you can work on patients as well. There's self-instruction. These ones are generally online where you're looking at things and taking a quiz at the end yourself. There's webinars like you guys are on right now. And then there's in-person lectures. The best ways I've learned to find good courses, honestly, is word of mouth. And that's how patients find you as well, is through word of mouth. So I ask other fellow clinicians, hey, what course did you do last year? Did you like them? Would you recommend them? And then at courses, if I really enjoy the course, I ask the other providers that are there, hey, have you been to any other courses on implants, veneers, anything like that? Would you recommend those? Where are they? When are they? And look them up as well. There also are the organized dentistry organizations that offer continuing education courses or sponsor continuing education courses. So we've got the General Dentist Society, we've got the ADA, dental schools all around the nation always have continuing ed as well. Those are a great resource. Specialty organizations as well. And then, of course, Clinicians Report, as you guys are on right now. But then we also have the Practical Clinical courses by Gordon, and those are in person and hands-on. So you're able to get a little bit more experience with those courses as well. When we talk about finding our community, another good quote that I had and that kind of reflected on the social isolation of dentists as they are the entrepreneur, they're the owner dentist, is entrepreneurs are especially vulnerable for the consequences of loneliness. Weak boundaries between work and life outside of work, which may have deleterious effects on entrepreneurs' ability to relax, recover, and connect with others. All factors that otherwise could help them cope with the loneliness. So when we're talking about our ultimate strive to be a practice owner, we do need to think about, okay, we're going to be the entrepreneur of this business. What boundaries are we going to form with our employees? What boundaries are we going to form with our patients? We also need to think about what boundaries are we going to form with our work-life balance. And being able to form those boundaries helps us to combat that loneliness as well and form the relationships that we need to keep our community strong in dentistry. Communication is very important as well, as I've touched on a little bit through each slide, but I do want to focus a little bit on having good communication with your staff by sharing a fun little story. I had a temp assistant help me my first year in practice, and I was so used to my regular assistant mixing cement for a post and core for me and handing it to me in a composite gun. And so I told the temp assistant to do the same thing. Well, she mixed temp bond and put it in the syringe to give to me. And my post and core buildup just was not setting. And I was so confused and I couldn't figure out why. And 10 minutes later, it still wasn't set. And so I looked at what she had mixed and gave me and noticed it was temp bond. So I definitely lacked in communication because I just said, go do that over there, please. I didn't give clear instructions to her, and I have never done that since. I always over communicate with my staff now so that I don't have to run into any problems and have to remove a post and core and some lovely temp bond and then re-prep my tooth to be able to get good bonding. We also want to make sure that we communicate really well with our patients as well, which I'll talk a little bit more on the next slide about that with informed consent. But then our colleagues, we want to have good communication with because they're the ones that we form our community with. Our specialists, especially, we really need to have good communication with them so we can have the best outcomes possible for our patients. And then the bosses and managers that we work with. You want to make sure that you're able to communicate your wants and needs if you are an employee and be able to discuss how's the best way to form good patient care in the office that you're in. Informed consent is extremely important. They talk about it in dental school, but I feel like it's extremely important to touch on it really hard right now. Good communication is important for informed consent. Informed consent is not just handing our patients a paper and say, go over this and sign it. It's so important to discuss the risks and potential outcomes of what could happen on what you're going to do for that day. It prevents so many headaches in case one of the negative risks does actually happen. And it's also important to give your patient every option for treatment. And this includes mandatory things. Hey, you have active bacteria, we need to do an SRP. Elective things. Hey, there's a chipped tooth right here. It's not causing any problems, but we can repair that. And future things. All right, you've got missing teeth here. These are your options for the missing teeth. You never know what the patient is planning or wanting to do. And it's important to not have any biases. There have been a couple courses I've gone to that they talk about this. You don't ever look at a patient and say, okay, they can't afford an implant, so I'm not going to give them the option of implant, or this person is very well done, like done up. They only want implants. I'm not going to give them the option of a flipper. There have been plenty of patients that I've worked with that have wanted a flipper where I thought they were going to have an implant and vice versa. So it's very important to never have any biases for what treatment you're going to offer for your patients. And then it's important to go through the consent form with them and always talk about the potential risks with everything. And it's better, the best way that I discuss it with my patients is I say, we plan for the worst, but hope for the best. And then they're generally very happy when you have the best outcomes happen, and they're never too disappointed when the worst outcome happens because they knew that it was a potential risk that could happen, and we have a plan in place of how to handle it. Instructions are meant to help. This is also important as well. It's so important to communicate instructions with your staff. They are not trained dentists, so you need to treat them like they're not trained dentists and be able to give them clear instructions on things that you want. You need to tell them exactly how you want them to mix things, exactly what materials you would like, what time frames. Most assistants, unless they have been told, don't know that you're supposed to etch for 30 seconds to a minute and scrub bond for 30 seconds. They think it could be 5 seconds and they would like to rinse it as soon as you put it on. So it's very important to be able to communicate instructions with your staff. And it's important to know timeframes for different things as well. Sometimes we would like to cement a permanent crown, have a patient bite on a cotton roll and go do an exam and have our assistant clean up the cement, but do they know how long it needs to sit isolated before the cement is set? Is it isolated, or is the patient salivating? It's important to be able to communicate all of these things with your staff if you want them to help them to be the best staff member as well. And then it's also important to know specific compatible materials that go together, and the instructions help with that. The instructions will also tell us best uses for material, safety instructions in case you ever get the material in a patient's eye. Heaven forbid, they should have safety glasses on, in your assistant's eye, or on bare skin, or if the patient ever accidentally swallows anything. It's important to know those things before you use these products. And then another good one that a lot of people don't think about is the temperature for storage. If you've worked in a dental office and a dentist did something one way and then you become a dentist down the road, you think, okay, my dentist that I worked for always put composite in the fridge. It has to be stored in the fridge. Well, if you look at your composite, does it say that the temperature for ideal storage is 30 degrees Fahrenheit, or does it say that it should be 70 degrees Fahrenheit? Something that's very important to know so that you're not having products go to waste or not work anymore because you've not stored them in the correct manner. So bottom line for all of these different things, sorry for the little rough start, not being able to figure out my screen share. Technology is always my favorite thing. We want to make sure that choosing continuing education course should be like planning a vacation. It's furthering your career and you're spending a lot of money. So we always want to make sure that you put a lot of effort into your continuing education courses and make sure that they're viable sources. And then you want to establish a community in your career so that you are able to avoid social isolation. You're able to maintain a healthy, good relationship with your career. We want to be happy dentists for the rest of our career. We don't want to be those dentists that have negative outlooks on life and they hate going to work and they dread anything that could happen at work. Communication is imperative, not only just in the workplace between our staff members, but also with our patients. We need to have good communication to be able to give the best informed consent for all procedures, so patients never have any surprises for them. And always make sure to read instructions before you use materials. Don't try and be a cowboy and just use a material because you think you know how to use it. All right. Thank you guys so much for tuning in on things I really wish I knew when I first left dental school.